on a sunny day. Oh, we've still got the sun. Nice. Before we begin, there's no fire drills planned this morning. In the event of the fire alarm sounding, we need to leave the Newlands room, rest through the restaurant and leave through the rear doors building. I'd like to welcome Councilor when you vote it, Executive Councillor for Adult Care and Public Health. Sue Woolley might be joining us, or she might be here. That could be CW, but is joining via Teams. So welcome, Sue. And Glenn Garrard, our Executive Director of Adult Care and Community Wellbeing. Other participants will be introduced as we reach their item and when you're going to speak. The public part of this meeting will be recorded and uploaded to the website after the meeting. So, just for the record, I have to leave for half an hour, so at 5 to 11. So Andrew will take over wherever we are. But obviously, if this item changes at 10 to 11, I will change on the item, not on the time. So, unfortunately, it's unavoidable. This week seems to be a bit chaotic all over. So, on that, I'll start with apologies.
Thank you, Chairman. We received apologies from Councilor Nicola Clark and Mark.
Thank you. Any declarations of interest? If any members have any interest that arise, please let us know accordingly. Announcement, Glenn.
Thank you, Chair. Just a few things, if I may. The first is members will appreciate this is an additional supplement to the programme. I'm very grateful for members' time to allow us to bring to you one particular item that's on the agenda today. I should also apologise for the late arrival of the papers. A whole range of different factors have influenced us, which I hope won't be repeated again. We lost IMTs for 3 days last week, and that has had a direct effect on our ability to distribute papers. So apologies for that. And also, it's a very rare thing for me to bring to you a pink item, a confidential paper. I think this is only the second or third I've brought in over 10 years. But I'm hoping that colleagues will explain why that's the case. But it is exceptional, and I think on this occasion very necessary. Thank you.
Yeah, thank you. I would just on that item number 6. I don't know if you've all got Modern Gov. I don't. One Modern Gov I'm on here hasn't uploaded that item, so I'm working off what's been circulated via email. Apparently, there's another Modern Gov which does load up pink paper material, and I think it depends on which Modern Gov that you're on. So, as I'm now all fully electronic, be prepared for I might have a little mishap or messing about between all these different scenarios, but we're trying. Okay, there's been a small change in the agenda order. I plan to take item 4, substance misuse treatment service first, and then we'll take item 3, sexual health services after that. So, which has all been agreed. So on that, then I'll hold on. I guess like what about minutes?
Because it's an additional meeting, we'll consider both sets at the next meeting.
Okay, brilliant. Thank you. So item 4, then the extension of the substance misuse treatment service contract. For this, I'd like to welcome Carl Miller and Lucy Gavins. Carl, Commercial Procurement Manager, and Lucy, Consultant in Public Health. Welcome, Lucy and Carl.
Thank you very much. I'll start first if that's okay with everyone. So this paper is asking Scrutiny to consider a report on a 6-month extension of our substance misuse treatment and recovery contract in Lincolnshire. So the substance misuse service provides treatment and support for people in the community with drug and alcohol problems. And the recovery service supports people who've been through treatment and who are working to stay drug and alcohol free. And they're specialist services. And they work alongside a range of other organisations that support people who are experiencing harm from drugs and or alcohol, which are outside the scope of this paper. So this is specifically focusing on the specialist services. There are other services out there, for example, One Year Lincolnshire supports people with alcohol problems. External organisations such as Alcoholics Anonymous and Narcotics Anonymous also contribute to the overall support for people with who are experiencing drug and or alcohol-related harms. The Lincolnshire County Council currently commissions the delivery of our specialist substance misuse treatment and recovery services through we've got existing contractual arrangements with We Are With You, which is a registered charity. And we are currently undertaking pre-procurement as part of planned recommissioning work for those services. But we've identified some opportunities that, in order to make the most of, we will require an extension to the current contract. The current contracts have already been extended to their full available in contract dates, end date, which is the 30th of October, and that's why we've come today to consider for your considerations on a request for a 6-month extension. The current providers for both the treatment and recovery service are performing well. The total cost of that 6-month extension, which would be to the 31st of March 2024, is just over 2.5 million for the treatment services and 199,000 for the recovery service. That cost is consistent with the current cost of the service and would be funded in full from the public health grant. And the level of funding is built into our medium-term financial plan, and of course we'll be considering future costs as part of recommissioning considerations. In addition to the core substance misuse specialist service, which is funded from the grant, this financial year we've also been given an additional 1.4 million from national government to enhance the quality and breadth of our substance misuse services in Lincolnshire. That additional funding has been targeted towards priority groups, for example, people who are in contact with the criminal justice system and people who are rough sleeping or at risk of rough sleeping. And that additional grant funding is expected to increase year on year to 24-25. We've been given indicative amounts through to the end of the 24-25 financial year. And there is a requirement of that additional grant funding that we maintain public health grant spending on substance misuse at 2021-22 levels. So we're asking for consideration of the 6-month extension for 3 reasons. The first and main reason is because, as I'm sure you will all be aware, we're currently in a public health pilot with Greater Lincolnshire, and that extra 6 months would enable us to fully explore opportunities around commissioning collaboration with North Lincolnshire and North East Lincolnshire as part of that public health pilot. Particularly what we're thinking about is the recommended extension would give us some time to work through options, thinking about achieving efficiencies and improving outcomes for services across Lincolnshire and Greater Lincolnshire. There are a number of commissioning options for us to explore, including but not limited to a single service, aligning service specifications, and commissioning one provider to work across the whole patch but to slightly different specifications. So there are a number of different opportunities for us to explore and what some of the advantages we think of working more closely on that Greater Lincolnshire footprint would be around accessibility of services for local people and also around reduced administration costs. To support this work, North Lincolnshire and North East Lincolnshire have already extended their substance misuse service contracts just to buy us that extra additional time just to work through commissioning options. So there are a couple of other reasons for which I will hand over to Carl.
Thanks, Lucy. Yeah, as Lucy mentioned, because we're expecting significant annual increases in the supplemental substance misuse treatment and recovery grants and the rough sleep with drug and alcohol treatment grants, 6-month extension would allow us to align the contract year, the contract anniversary to the grant award date, and that will make both process of application for future years grant funding and the practical utilisation of that funding significantly more straightforward to administer. The other factor that's played into the proposal to extend is the introduction of a new procurement regime for health-related services and the impact of that on the governance and decision making for this this programme. So the Health and Social Care Act 2022 introduces a new procurement regime called the Provider Selection Regime, or PSR. And that will govern the procurement of healthcare contracts, including local authority commissioned health services, of which substance misuse and integrated sexual health services fall into that bracket. So PSR represents the government's position on the most efficient and effective way to commission and procure health services specifically, and it produces a regime tailored to those services as opposed to the more general regime set out in the current prevailing procurement regulations, the public contract regulations 2015. We know that the Department of Health wishes to implement PSR later in 2022, but as yet we're still awaiting details regarding the final formulation of the regulations, plus associated secondary legislation and statutory guidance, as well as the precise timing of the plans to implement it. And that's significant in the context of this recommissioning exercise, in that the implementation of PSR appears very likely to coincide with formal governance for this commissioning programme, if we're working to the current timelines of new services to start in October 2023. And that will make it challenging for us to properly take account of PSR in the recommendations around the procurement methodology and process for the new services. So the extension will enable us essentially to take account of both the national and local implementation of PSR, have that managed first and give time to consider the application and potential benefits of the new regime to the recommissioning and procurement of substance misuse services. As Lucy said, the services are performing well. There are no current issues or concerns relating to provider performance that would negate progression with an extension of the contract for 6 months. And again, in terms of cost implications, the 6-month extension would be consistent with the current funding costs and budgets, which would be funding from the public health grant. So there's no additional funding requirement as a result of the proposal to extend. Future service budget, of course, will be considered as part of the commissioning review of substance misuse services beyond 1st of April 2024, if the proposal is approved. In terms of the procurement implications for the proposed extension, there is no provision in the current contracts to extend beyond September 2023, so a decision to extend will need to be managed by variations to the contracts. Council's contract regulations require variations not expressly in scope to be considered for procurement of a new contract. However, they do permit exceptions to be made where approved by the appropriate decision maker, and to support that decision, it needs to be demonstrated that that decision was compliant with procurement legislation. So for a variation to the treatment service at the value of 2.49 million, that decision would need to be approved by the executive. For the recovery contract at 199,000, that would be a chief officer decision and subject to support of the executive for the recommendations of this report. Approval of the exception for the recovery contract will be progressed with the chief officer at the appropriate time. Just thinking about whether we would satisfy the requirements of procurement legislation around the modification of contracts. Public contract regulations do permit modifications where, irrespective of the value, they aren't substantial within the meaning defined in the regulations, and the proposed modification here, the 6-month extension, are considered to meet those requirements. So in terms of the regulation, there wouldn't be anything to prevent us from approving this.
Okay, thank you. Just a couple of terminologies. Rough sleep drug, what, do they get drunk when they go rough sleeping, or is it actually just they go, or is it?
So the rough sleepers drug and alcohol treatment grant is some specific national government funding that's been given to Lincolnshire to support people who are rough sleeping and to maintain participation in substance misuse treatment. So it's additional funding to support people who are rough sleeping or at risk of rough sleeping with becoming drug alcohol free, reducing the harm from their substances.
So in essence, the difference between We Are With You and One New Lincolnshire is that one's more extreme than the other, i.e. you've got bigger problems.
Yes. So the We Are With You is a specialist service. One New Lincolnshire supports people only with alcohol problems and a lower level need.
I think it might pay that when this all comes back, is we perhaps have perhaps a defining of the word misuse substance, because I think that it's likely moved on, and I think some of those issues actually I perhaps don't even have a clue what some areas you're necessarily talking about now, and I say that because I know, I don't know, but it wouldn't be a bad thing to just get an overview of actually what is classified in that situation. Okay, so.
Yeah, I was a similar question actually. I was trying to get an understanding of the levels of information where and how that fitted in with any, public health preventative work that we were doing, and kind of whether there was a tiered approach and who was doing what when.
Yeah, absolutely. So we do have a tiered approach. So we would kind of talk about 3 levels of prevention and treatment.
Okay.
So we have our what we would call the universal offer. So generic advice around alcohol and drinking at safe levels, support that goes into schools, for example, for children, etc., etc. All of that would sort of, it's really targeted, it's universal advice that's shown in the whole population. We then have more bespoke preventative services and lower level treatment services, which support people who perhaps are drinking at what we would consider a harmful level. Perhaps they regularly binge drink, or they're drinking, a bottle of wine a day, but actually they're not dependent. They could stop drinking, and what they need is some support. We would give support with how to manage and change their behaviour in the context of their daily life, recognising particularly for alcohol consumption that it's a really socially acceptable activity. So how do people develop their own management techniques to drink a bit less? So that's what One New Lincolnshire offers. It's more of a group support. But it's a program, it's a 6-session program, and they've supported people throughout the pandemic, but actually we've seen a big increase in uptake since the pandemic, since over the last year really, with people seeking support from One New Lincolnshire. The services that We Are With You provide are what we would call specialist services, so for people who've got problems, who are experiencing any kind of harm really from alcohol or illicit drug use, or actually non-illicit drug use, so misuse of over-the-counter medications or prescribed medications as well. It's much more intensive, so it's one-to-one support quite regularly. Sometimes it comes linked with requirements around the criminal justice system for regular drug testing. There are also group sessions, but that's on top of that individual one-to-one support. And often there's also pharmacological interventions as well. So for someone who might be dependent on opioids, that methadone maintenance, for example, as a replacement. So it's sort of scaled. And the recovery service, for anyone who's been through that specialist treatment, the recovery service is there to support them as they leave formal treatment back into kind of rebuilding their lives, finding jobs, kind of meaningful social activities with other people who perhaps are trying to stay abstinent from alcohol as well. So it's that kind of wraparound support, if you like, to maintain a drug that or alcohol free. So it's tiered in that way.
You mentioned the some, and you've talked about how some people come into the fight, folks who criminal justice system. What the referral routes are there? And you have to be there correctly because can people self-refer to the lower levels of intervention?
Yeah.
GPs, how do people get to it and understand what it is?
Yeah, absolutely. So all of the services we're talking about, you can self-refer into, but also there are professional routes in as well. So anyone from across the NHS, so we do work with GPs to help them to understand what the service is and what it offers, so that if they're seeing a patient who might benefit from the service, they can share information, signpost, ideally signpost them into the service or help them to refer themselves into the service. We see that for alcohol, for adults, around about 70% of people who are in our services are self-referrals. So they're choosing to sign up to the service and the support that it offers. It's a different picture for children and young people, where about 75% of referrals come from educational children's services, and then a smaller number come from family and friends and young people themselves. So we do track where referrals are coming from. And if we see a change, if we see it drops off or increases, then we'll do a bit of a deep dive to understand what's happening there and make sure that if we need to remind people about the services that are available, that we're having these ongoing conversations.
On the receiving of it, and it's fantastic for that. And it's been quite I just think it's been waiting for something like this. It's not just about receiving on the streets, it's about all our social services we have, we know addictive drugs, alcohol, and there's not really been any particular route for them. Obviously, district councils and county councils have been trying to help them. There's been nothing really to keep them in that service, and I think this is excellent. And whether they but it is something that
Absolutely. It's assertive outreach, so it means rather than expecting people to come to us, we go to them, and there's a really strong evidence base that it really helps people to reduce their drug.
Yeah, interesting. I fully support paper. Perfect sense in terms of procurement. No problem in terms of that. Some of the points has already been just in terms of what I was going to raise, but I represent a ward which is part of my ward. I've got 2 or 3 good dealers on every single street. The difficulty I have is that I don't really feel that the pathway to services is embedded, or the knowledge around how to refer into services is fully understood. I've got an NHS background, and I still find it quite difficult in terms of knowing how some of these referring into services is done. And I just think there's a lot more work to be done there. I think it would be hugely beneficial in terms of, we know that there's problems in the street, we know that there's problems in the community. How do we get people to get the right treatment, the right support, the right intervention? And then, great to hear that you're doing work in schools. It's finally really needed. Young children who probably far more have substance misuse and alcohol issues, and the how prolific it is in terms of young people. And it really is, even at high schools, etc., where you think that doesn't exist, but it does, it really does. Some of the horror stories, Bill, in terms of how you think young people of the age of 15, 16 are already starting to get down the wrong path. So it's great that you're doing work on that. More you can do, the better. I've welcomed you coming and talking to us in Gainsborough in terms of some of the work you do, and some of the successes you have, and really learning more about service. Line that up in the future as well.
Absolutely, be really happy to come along and talk in detail about the services and the prevention work that we're doing. Just touching on your first around drugs and illicit drug use and being the visibility in certain neighbourhoods of illicit drugs and access them. We are working closely with the police because part of the boost to treatment from the national grant, we have are specifically trying to target a number of different groups of people who might be in contact with the criminal justice system. So the police have got quite a few work programmes that are around things like trying to break down county lines, which we know we've got a challenge with in Lincolnshire, but also trying to connect with people as early as possible if they have got to the point where they're already engaging in some kind of criminal activity, to intervene as early as possible with our treatment support around drugs and alcohol. because we know that it's very easy to suddenly for it to snowball. And if we can catch people at that very first contact, be that with the police or with other statutory organisations, and can support them from a very early point, then we can often divert that pathway and hopefully over time reduce the number of people who are getting caught up in criminal activity around drugs and alcohol. So I think that it's a really important area of work for us.
So I've got Mike and then Karen.
Yeah, support the idea of what you're trying to do, this collaboration, doing it on another level, but it does seem a logical step to do. One of the things you mentioned to organisations and how good they are, how often, as it were, do we not test them, as it were, but review how they're operating, so that, as it were, another set of eyes looking at how they operate, trying to improve matters generally? Do you have sort of brainstorming sessions with them, or how do you collaborate with them to, as it were, to inspect them that we get value from them?
Yeah, so we have regular contract management meetings, which are to understand how the service is kind of performing against some of our key indicators that we look at. But actually, we have an ongoing dialogue with them in a number of different forums. So partly one-to-one, and if we see something or if we hear something from friends and family feedback that doesn't quite sound right, we want to probe, we will have that conversation with them. But there's also a partnership group across Lincolnshire that's made up of representatives from our services, but also from police, from probation, and from LPFT, from Mental Health Trust, from the Integrated Care Board, so from lots of different sectors, and we talk about our commission services as part of that broader conversation around prevention. And so we get, if you like, that kind of critical friend challenge through that forum as well, to make sure that we're not just sitting still, if you like, with the service. And then the other side to it is where we're always reviewing the evidence base and what other areas are doing and what works well. And we have regional and national meetings that the team attends to learn from best practice elsewhere. And we work with the provider to embed that within kind of the current contract where possible. And they are good at flexing with us to make sure that we don't stand still.
Yeah, and the two main charity workers, do they also have lots of contact with ex-military charities? Because unfortunately, it tends to be a high percentage of veterans who have the abuse either with alcohol or drugs. They fall through the net. I'm a member of the Legion, and they do a lot of work supportive. I didn't know whether the other charities were working backwards or forwards with these two organisations.
Yeah, absolutely. So particularly for We Are With You, which is the main treatment provider, they're a national organisation, and they work closely to understand kind of veterans' needs and ex-servicemen, ex-servicewomen's needs. And then also we work with colleagues in LPFT, particularly around veterans' mental health, to make sure that, because a lot of people will be experiencing dual diagnosis where they've got diagnosed mental health problems and a substance misuse problem, and there it's really important that we work closely together as organisations to support their needs, so that those conversations are ongoing.
Thank you very much.
Thank you, Karen.
Thanks. Firstly, just to say, just to commend the work that you're doing, I think this is a really positive thing. I've got an NHS background. I've got no connection with LPFT. I work in an inpatient ward, but we see them in the 30s and 40s when they get endocarditis from injection with dirty needles. So that's what it leads to potentially fatal things. But as a councillor, it's in my patch as well, quite significantly in my patch. I'm aware of that. But my question, and it's meant to be as a critical friend, because I think this is a great idea. If this contract is due to expire at the beginning of October, and we're now the 28th of September, and it's been going on since February, the work on it, why have we only just got this to committee?
It's October next year.
That's right. I've been reading this and I'm just trying to work it out.
I think
yeah.
I did say it, didn't
Yeah.
I think
Yeah.
when you spoke initially, you didn't say 2023, and I had to.
Sorry, yeah, that is absolutely very.
But I'd be interested in learning more about what you do, because it's certainly a problem in part of my patch. I don't know if we can bring that back to committee.
I think basically we are talking about 18 months before this contract really comes up. I mean, in theory, November we've got a performance. When you're to have a look at the KPIs on it. And it'd be brought in. I mean, I don't know what KPIs you've actually got. I think the problem is that in essence, this goes back quite a long time from the initial contract, which was done in 2015-16 or something. So for a lot of people, actually, it's technically a new item. But Glenn?
So I actually meant like the nuts and bolts of what you do, you know, service. I'd be happy to.
Thank you, Chair. So the normal performance report that you receive, and which is due in November, I think.
Yeah.
Wouldn't normally give you much detail on the Secretary of Health Services. If we were to bring something more on that area, that's entirely appropriate and something we can work on, particularly given members' interest in this one.
Yeah, I mean, it might, I mean, you'll have all the data anyway. I mean, we're not expecting a lot over, so I think it's just quite interesting for people to actually see what's what. But it is, like I say, specialist focus. And I think, you know, just to sort of, we are here actually to sort of look at extending the contract, not to actually go into detail on the service, but actually as it sort of happens to not necessarily being circulated for a while, it's why there's an interest.
Yeah, contract managers actually not here this morning, but as part of the review of the services, should be coming into scrutiny and it would cover off in terms of performance today. So that is coming. It's this extension allows for more comprehensive work to be undertaken, as Lucy's described. So I think that comes as part of the recommissioning programme already.
Yeah, and to be fair, the new contract extension actually in principle allows it to be extended so that we can go for the Greater Lincolnshire procurement contract on this, which will be a game changer. I mean, that's one of the first basically contracts to come out of Greater Lincolnshire. So there is, in one sense, there's perhaps even more to looking at that, because it'd be interesting to know what their figures are in North and North East Lincolnshire, and in effect some of the situations. But that'd be too early yet to have that. I think what I'd say is it would be nice to get an update on when this contract is in some form of shape before it gets to the point where it's coming to us as a predetermined scrutiny item before it goes to the exec, by which time it gets much harder to interject at that point because we're nearly all at signing off. So I think when appropriate, and Simon, if you can hear, take a message for him, but I think it wants slotting in maybe in a year's time.
It'd be well before then,
Right.
because we have to, I mean, the process for procurement starts with 9 months to 12 months before.
Right,
So,
okay.
and you will receive it, you will receive an update on the service probably in early part of the spring of next
Okay,
year at
that's
the
fine.
latest, okay?
Is everyone okay with that? I think then actually it'd be better to, rather than sort of bring the figures to November's meeting, let's bring it all together in one sort of agenda item. Okay? Right, I've still got Tracy and Robin and Colin.
Chairman, I'm slightly a differing view in the room, I'm afraid. I do agree that the extension should happen, but on the basis that I think the procurement process afterwards needs to be creating a very, very different service indeed from what we're aiming at. In my division, there is alcohol and drug issues, as there is in everybody's. I don't see any evidence of we are with you. I'll be honest, I don't receive good feedback. In fact, I've received negative feedback. And if I'm being completely honest, we're actually sitting here saying that this service is good. We're actually saying that the level of service is good, yet we're also saying that their successful completions are below the national average. I'm sorry, I can't see how we can actually be measuring that as a good service. And for me, measuring the representations again, well, actually, is it that they've been cured and everything's okay? Or is it that they don't see the value in the service? They don't think the service is good enough to return to? And bearing in mind we're varying figures from 8 to the national average of 15.3, to me that's huge difference. So that would actually suggest to me that it's possibly more about the service not performing well enough than actually that the results are that good. So for me, I would be very nervous of it being a county-wide or with North and North East Lincolnshire as well, because we're not getting it right in my view, and we're going to be moving that service wider and further away. So I actually don't support it to go wider at this moment in time, unless we shape it and contract it managed possibly better and expect better. It shouldn't be saying that work is already underway to address this low completion level. They've had this contract since 2015. Work shouldn't be underway, it should have already been done. So sorry, I feel quite strongly about it.
Yeah,
Thank you.
that's fair. Bob?
Thanks, Jane. I was just reflecting on what Councillor Young was saying about the issues of his area. And I was just reflecting back in the mid-80s when I worked for mental health services in Lincolnshire. I remember we had one guy who was a community psychiatric nurse, and he covered the whole of Grantham. He was a specialist in drug and alcohol misuse. Now we look at the expansion, just indicates the scale of the problem we have. This county is absolutely massive. And I think it's sometimes that it's something that people prefer not to talk about, and I think it's important. The one thing that struck me is the term assertivity, because you know, those of us who've had some contact with people with drug and alcohol misuse, is actually getting them to use the service and making the decision to use the service. Work with a guy whose brother's out there because he was a drug user himself, and then he says to me one day, I've decided I'm going to go the same way as my brother if I don't do something about this. And he had the support from our service from LPT. Became an advocate for so I think anything that pushes assertiveness, reaching out to people rather than expecting people.
Colin?
Yes, thank you. Can I apologise for being late, Chair? Therefore, what I'm going to say now might come up, but I'm speaking in the role of the Lincolnshire County Council Armed Forces Chaplain, and I'm intrigued to know the relationship of the contract with Defence Medical Welfare Services and with Up Challenge. The reason I'm asking that question is the Defence Welfare Medical Services have just launched £2 million grant application exactly in this area. There were no applicants from Lincolnshire, Greater Lincolnshire, and I just hope that as this contract goes forward, we can harmonise central provision with our own provision. And so my question is, are we fully aligned? I know we've had conversations about this and we understand the relationship, but it would appear that in reality there are government grant opportunities that the contracting organisation couldn't draw down and hasn't significantly.
Yeah, thanks, Councillor Matthews. So we do work alongside colleagues in Up Courage and have regular conversations with that team in LPFT. I can't comment specifically on the Defence Medical Welfare Service application, but I can go away and have a look into it and just see what the options are. If it comes up again, then make sure that we're ready in position to apply.
I think we should have made contact with it. It's a communication thing, perhaps, and it may well be that it's not appropriate, but they didn't know about us. And it's an opportunity that might be missed.
I think there's also the need for us to have a better understanding of actually who's impact, where they're coming from, who are forward. You know, it's all right saying youth, it's all right saying army, but actually there's quite a lot in that whole sort of makeup. Well,
can I just clarify? A veteran is anybody who's worked for one day in the services, basically. So there are many more veterans out there than we would anticipate. They're not the people who turn up with their burying and their names. It's hundreds of thousands in our communities.
well, yeah, and I think, and the comment where you sort of work with the police. Police often aren't the people's best of friends at times, and actually people will do their best to avoid those in that service. And I'm not saying any other thing on that. I mean, just that. Okay. Well, sorry. Yeah.
Just going back to what Tracy said, Because obviously she said something that's completely in contrast perhaps to what other people have said, so I'm listening to her. On page 7, it does say works already underway to address the delayed national average performance. What? Because I think now Tracy's brought it up, we probably need to just ask you.
Yeah, absolutely.
Well, just on that, because one of the other things I think is we perhaps actually would like to see some performance figures in November on where we are, just so actually now it has been raised quite a few times. I think it would be good. I wouldn't expect giving a steer, but we perhaps wouldn't go into it in great detail because I think that's coming back and we might jump the gun, as Elena says, when we're going about 9 months. But
So I do think we need to just ask the question there.
Yeah, absolutely. So that performance measure has dipped in the last kind of 6 to 9 months. So before that, it was performing. They were performing better. We sat down with the service and understood some of the key things for that. So partly it was because they had some vacancies they were struggling to recruit, and so the staff in the service were carrying very high caseloads, which meant that they weren't able to offer the same intensity of support that they would have been doing otherwise. They've had a significant recruitment drive. We've managed to recruit posts across the county, even in some of our harder to reach places. So those staff now, they are in post. Obviously, it took a little while for them to get up to complete all of their training. But what that should mean is that we start to see more successful completion. One of the other challenges we have with that indicator, and this is where we need to make sure that our team within the service have got the right level of caseload and training, is that we're seeing an increase in complexity in the needs of people who are entering treatment. So through and since the pandemic, we've seen that the people who are coming forward for treatment have complex needs across a number of domains of their lives, so perhaps across their housing, across employment, family relationships, and that makes it much more difficult to sustain and kind of complete treatment. So it's that combination of not enough staff in the service, which has been rectified, but will take a little while to think through, with the increasingly complex needs of the people who are coming forward for treatment, which of course raises other flags. For example, people who have got less of them, where are they going? And making sure that we access those through that tiered approach and tiered support that I mentioned in relation to Council Park.
And the amount of foreign nationals that we have, especially in the South London area, Smalley, Boston, huge problem with foreign nationals that won't engage, and they are really, really hard to reach.
Thank you, Liz. Can I thank you for your clear answers today, because it's been really helpful and really interesting.
I think I just sort of seem to have perhaps dug in deep and now right. So in essence here, our actions required is to consider the attack report and determine whether the committee supports the recommendations to the executive set out in the report. I take it that I think we can agree that actually the actions are correct going forward, and then to agree any additional comments to be passed on to the executive in relation to this item. But we seem to have sort of started to sort of dig a bit deeper, and I think we perhaps all agree, don't you, that you want something back November just to start to sort of have a bit more of a look at actually some of the figures involved here. And just sort of bring
You did not say this spring.
well, this one, yeah, but we've got two things, haven't we? There's potentially your KPIs, and then there's the spring is when we're looking at the whole procurement contract. Now, it's whether we wait to align one or whether you actually want some figures just to see what actually is going on in November without it being a full item, but more a bolt on to the actual performance figures. What's your view?
Can I just clarify? What I was asking for was something about the service that you're delivering. I think that's what you were asking for. Because to be able to understand if you're delivering, if whoever is delivering it well or not as well as they could be, we need to know what you're actually delivering and who you're dealing with. So it's not about numbers and figures, it's about the service that's being delivered.
Yeah, well then we're going into a full-fledged item, which then becomes Alina's, what Alina's referring to is in spring.
Yeah, but we're a scrutiny committee, and that's, for me, that's class for scrutiny.
Yeah, well, that's what I'm trying to say. That's what we're trying to figure out is actually what does everybody want? Because between everybody, you suddenly all want either one part or all of it.
Is it balanced to say January, February, that it can come back as a full item with
This is
events?
what I'm saying, yeah.
Rather than November or spring?
I'm afraid
Okay.
that just wouldn't be possible. There's a huge amount of work got to go into the commissioning programme. So
Okay, no, that's
in
fine.
terms of just setting the baseline here, colleagues are here today to look for an extension so we can maximise and capitalise on potential wider opportunities. That work will come back to this scrutiny. It will be around late spring, early summer, when all of that work's been completed. What I believe, Chairman, you're asking for is to understand much more about the performance of the existing contract.
Well, we've got.
So this is about procurement today. The contract manager who manages the contract isn't here. But what I've done is, I as her manager, I'm not aware of any problems regarding the performance of that contract. However, I will ask her to come back to scrutiny to give you an overview of the performance. But it's much more about here and now rather than next year will be about what we're looking at in terms of a strategy going forward. Does that make sense?
Yes, and all I'm trying to do is instigate a base in, say, November to give a bit more summary before we go into the. And if anyone wants to do further research, they can do. And then come spring, early summer, then everything comes back and we can have a look at it. And then, of course, it will then come back when it's shaped up, before it goes to the executive.
But as a councillor who represents a division, I want to know more about what you do, because that affects the people that I represent, regardless of what this agenda is. If I do that separately to that committee, if it's something to happen, that's fine.
Initial.
But I'm not asking about your numbers and the process. I'm asking about what actually happens, because that would be helpful for me to help the people I represent.
And I think that's the point around, however you wrap it up, performance. I'm not necessarily talking about numbers because some of that is commercially sensitive.
Yeah.
But absolutely coming to explain about how the existing service works and how.
20-minute presentation.
Yeah.
And that we'd be able to do something.
Just feels a bit like pulling teeth, that's all.
Right. Yeah. Great. Yeah. Tracy.
Thank you, Councillor.
No, no,
Thank you. I would potentially agree with Alina that we're at cross purposes here completely. So yes, absolutely, that's great. But actually what I think all of us want in one form or another is actually understand what we are with you are about. So be it whether it's what the service looks like, be it whether it's the figures, and I would find it extremely disappointing if that couldn't come forwards in November, even if it means no work for you guys, but actually we are with you on the ones that turn up in front of us and tell us about it. So I don't think big
May I suggest a compromise probably, because I think this
Well,
goes beyond.
Alina said it will be a summary.
Yeah, so I think that's absolutely the idea.
It will be a summary and then there'll be some KPIs. We're not going full depth because that will be next year.
No, and I think that's
And can I
useful
just-
because it will give a
And
feeling.
it's just,
of
yeah,
feel
so
that
you'll
later.
be able to understand the figures because you'll have a bit more of an understanding of the current arrangement. Will be summarised
That's
by
not
the performance contract manager, who is not here today, who will come in November.
Yes.
And it's all about benchmarking, looking at performances in November, so we'll stick to November. Good, that's done.
Could I just suggest what I was going to say was, so it's nothing to do with this committee, was the fact that I think this goes beyond this committee and maybe all councillors have an interest in this. And maybe it's something that a council development session could address, and then we would all understand what goes on, including people who want.
That's okay, but can I just say, before we do a council development, get engineer up here to develop, or else we're going to really confuse the job, because it's going to transform from where it is now to where it's going quite significantly. Anyway, so we're happy with that in November. We're happy with the forward plan going in late spring, early summer. Any other comments for the executive? We're all supportive. I'm in a current situation. Brilliant. Thank you very much on that agenda item. Thank you for coming. And talk about opening kind of worms, but actually it's a great one because it's causing, and there's a lot to be in this. So I think, and in theory, you should see really good results on a one-to-one performance focused model. So, brilliant. Thank you very much. On that note, Andrew, you're going into sexual activities now.
I'll be there.
Well, thank you for that.
Thank you very much.
Thank you. I'll be back in half an hour. There you go. Thank you.
So we're on item 3 now. I think that's right, and we've gone backwards. So we presented by Carl Miller and Natalie Little. Thank you.
Morning, everybody. I'll start if I may. Today we're coming to Scrutiny to talk to you about the proposal for a 12-month extension of the contract. Responsibility for commissioning of sexual health and reproductive health and HIV is shared across local authorities, our health colleagues and NHS in London. In Lincolnshire, we currently commission the delivery of those sexual health and reproductive health services through a series of contractual arrangements, and some with Lincolnshire Community Health Service, so LCHS, that you'll be aware of, a registered charity provider, which is Positive Health Lincolnshire, and with our GP practices and our community pharmacists. Currently, all of our contracts for sexual and reproductive health services across Lincolnshire are currently due to end 31st of March 2023. And current contracted services are all performing to a high standard, and service providers have already indicated their support in terms of the proposal for this extension today, if approved. The 12-month extension does not increase the cost of the sexual health services above the current contract value. Baseline funding for sexual health services is supplemented by our public health grant reserve, and that's through until the 31st of March 2027. Funding envelope for this will need to be considered as we move through the procurement services beyond the 1st of April 2024. And as similar to Lucy, actually, we are now at that point where a recommissioning programme is very much underway at the moment, and similar emerging pictures are starting to impact, and they have contributed to us coming to Scrutiny today to seek that approval for the extension to contract. Fundamentally, the contract extension will give us the ability across our several contracts to have determinist alignment of the contracts whilst we consider the Greater Lincolnshire proposal, and the fact that we will be able to look to do something across Greater Lincolnshire with that collaboration with North Lincolnshire Council, which we believe will give greater efficiency, but also open access to a wider population group and improve their health outcomes in terms of sexual health and reproductive health. And at this point, proposals that are coming through for sexual health in terms of that new model for Greater Lincolnshire could be, but aren't limited to one particular contract and individual lots with a joint digital offer, because I think there's a recognition now more than ever that people are accessing our services very differently to the way that they used to do, and we really want to commit and invest and collaborate with people who are accessing the service in terms of co-production and making sure that we understand the views and the needs of those people that we're trying to reach, and that services are accessible to people on that platform. But also, we are very much in the context at the moment that we are awaiting a national sexual health strategy, and that is fundamental in terms of the re-procurement of any services across the industry. It's really important for us that we take a view in terms of our national evidence base to look at what we ought to be doing, and we expect that national strategy will be coming through later this year. So a real crucial key point in terms of our timeline for re-procurement, because we want to make sure that whatever specification we are designing for Lincolnshire and for our population is as very best as it can be and takes account of those national recommendations. Separate to that, it is also the impact of the provider selection regime, which will, we believe, give us the flexibility and tendering those health and care services in the future. And it's something, if I may, I'll pass on to Paul to kind of just talk about.
Thanks, Natalie. Yeah, I mean, again, as with the substance misuse services paper, the sexual and reproductive health services are health services, and that will be in scope of the new procurement regime. So, without going through all of the detail, again, this extension will enable the council to take full account of those changes in a planned and ongoing recommissioning of sexual and reproductive health services across Lincolnshire. As Natalie's said, the integrated sexual health provider and the sexual health outreach service provider are both performing extremely well. So again, no performance issues that would negatively impact a decision to extend, and both providers have been engaged and will be supportive of recommendation should the council decide to proceed with it. In terms of the procurement implications for this one, it's a similar picture again as it was for substance misuse services. So the LARC and EHC, which are long-acting reversible contraceptive and emergency hormonal contraceptive services with GPs and pharmacies respectively, have permitted extensions available in those contracts. So they can go a further year from 31st of March 23 through to 24 without any procurement implications. For the LISH and the sexual health outreach services, there is no provision in the contracts to extend beyond 31st of March next year. So a decision to extend would need to be managed by variations of the contracts again. And again, taking into account the permissible exception to contract regulations for approval by an appropriate decision maker, the variation to the LISH contract, which is the big one, to extend by 12 months at a value of £5.3 million would need to be approved by the executive. The smaller of those two, the sexual health outreach service at a value of 206,000 would be chief officer decision. So again, we propose, subject to the support of the executive, for the recommendations in the report, i.e. the extension of the integrated sexual health service, approval of the exception for the outreach service would then be taken to the chief officer at the appropriate time. In terms of satisfying the procurement legislation relating to the modification of contracts, again, this would fall within the scope of permitting modifications because irrespective of the value, these changes wouldn't be substantial within the meaning defined in the regulation. So not an issue from a procurement perspective. The decision really will hinge on the justification for extending aligns to consideration of the opportunities for integration across Greater Lincolnshire and consideration of the new national sexual health strategy.
Thank you very, very much. Does anyone have anything to say? Colin.
I'm trying to work out from what it says in the paper about GP services, the relationship between the effectiveness of this outstanding service and the quality of local GP services. Are there, I believe there are, areas in the county where the GP services are failing to the extent that this service is failing?
Well, the challenges around the delivery of the long-acting contraceptive services delivered by GPs are really rooted in the cessation of delivery, which resulted from the pandemic. Whilst services are now operating in GP practices again and are building back towards the levels of availability and delivery that we saw pre-pandemic, that there are other challenges associated. GPs need to maintain their accreditations to fit the devices. Sorry, that's not quite the correct terminology. And some of those accreditations have lapsed. So we're working proactively through contract management with GP practices to try and encourage the uptake and the access of to the relevant qualifications to enable them to take on those services. It's worth noting as well that the integrated sexual health service also offers comparable services. So if Lincolnshire residents aren't able to access those services but require them, they aren't able to access them from their local GP surgery, they could be referred into or should be referred into the integrated service in order to enable them to access from a primary care provider what they need.
Thank you. Tracy.
Fully support this one. I do think it is more of a programme that could be much more about the way Lincolnshire one, so I feel really comfortable with it. I don't know whether the positive health links was the ones that done things with our local youth club, for example, but it was positive if it was you guys. So for me, yeah, all for this one, I'm happy. But yeah.
Goodness me. If no one's got anything else to say, what we need to do, well, you guys are, you won't believe it when it comes back. To consider the report and determine whether the committee supports the 3 recommendations to the executive. These are on page 4 of the report, so I won't read them all out, but there's 3 recommendations, basically approving the modification, the contract, approving the extension, and delegating details. So is everybody happy that we accept those recommendations on page 4? Are there any additional comments we need to pass to the executive? No? Thank you both very much.
Thank you.
Thanks. We move to item 5, and I think I need to read this out. I'd like, we've now reached a part of the meeting where we're due to consider a report containing exempt information. I'd like to move the motion to exclude the press and public. In accordance with section 100A(4) of the Local Government Act 1972, the press and public be excluded from the meeting on the grounds that agenda item 6 contains exempt information as defined in paragraph 3 of part 1 of the scheduled 12A of the Local Government Act 1972. Could I have a second, please? Tracy, all those in favour? Anyone against? Any abstain?